Peyronie's disease is a condition in which there is scar tissue that builds up on the strength layer tubes of the penis, which hold the blood that provides an erection. The Peyronie's disease can cause curvature as well as erectile dysfunction, and many guys are able to feel a plaque or a hard spot on their penis where that scar tissue is formed. We do not have a proven mechanism for how this condition begins or develops, but one theory is that of microtraumas, which can be caused if you have a poorer quality erection and it's not as rigid. Then there may be bending during sexual activity, can cause small injuries, and then those injuries set off a cascade of inflammation and scar formation, which then can develop into the Peyronie's disease. Some guys may develop Peyronie's disease with a plaque they can feel with that scar tissue on the penis and have no impact. However, many guys develop curvature of the penis, which may make intercourse difficult, especially certain positions, and the Peyronie's disease may also cause erectile dysfunction, causing poor quality erections. Peyronie's disease can be diagnosed with a history and physical exam. I can examine the penis and see if there is a hard spot or nodule, and then most importantly is your description as the patient. If you have noticed curvature of the penis and it's new as an adult, then there really aren't many conditions that cause curvature of the penis, so it's most likely Peyronie's disease. We have a variety of treatment options available for Peyronie's disease. What's important to note is that most of these treatments are only aimed to treat the curvature, to straighten the penis. Most of them do not improve erectile function, and they also may not make the hard plaque or that nodule go away. So Xiaflex is an injectable medicine in which we inject it into that hard plaque, which it's done over the course of multiple injections. Each course is approximately 2 months, which includes 2 shots, and then the full treatment is 8 shots total. After the shots, you would go home and perform penile modeling, in which you're trying to bend the penis in order to encourage straightening, in addition to this Xiaflex medication, which is intended to break down the plaque. The other options are surgical options. One is known as plication, in which I would put sutures into the strength layer of the penis on the opposite side of the curve, which would effectively straighten it out. One side effect with this is you may see penile shortening. Another option is grafting, in which we dissect out the hard spot, the plaque, and either cut it or cut it out and then place a graft over it. One complication for this is that it may cause worse erections, but it does effectively straighten the penis without the shortening. And then the final option is a great option if you have a combination of erectile dysfunction and Peyronie's disease with curvature, and that's an inflatable penile prosthesis. This is the option that would actually improve your erectile dysfunction. This would give you reliable, hard erections, and we can straighten the penis in the process. In order to determine which treatment is right, I typically perform a penile Doppler ultrasound, in which I have you come into the clinic. I inject a medicine into the penis which will stimulate an erection, and then I take measurements using an ultrasound to measure blood flow in and out of the penis. I also use a measuring device to get an exact measurement of the angle of the curvature. And all of this information is important when it comes to counseling you on which treatment option is best. The natural history of Peyronie's disease typically includes an active phase in which there is some pain while that plaque and scar tissue is developing. and that's when you may see the curvature getting worse. Then, after 3 to 6 months typically, you'll see it reach a plateau where then it's in a stable plaque phase in which the curvature is stable and typically doesn't change. However, there are some cases in which the curvature improves over time naturally. It's important to note that this is not a disease that spreads to other parts of the body, and it's not a cancer that needs to be treated. The reasons for treatment would be in order to improve sexual health.